Good afternoon. Good afternoon, White Plains. Good afternoon, everybody. Good afternoon. I'm going to wait just a couple of seconds to allow everybody to jump in. Just going to wait a couple of seconds and we'll get started with today's update. As a reminder, no problem if you couldn't jump in. I know you got the invitation to this a little late this morning. No problem. This will be posted on the district's website, and we'll also leave it up on Facebook page. And as always, you can always reach out and ask any questions that you might have on your at your convenience, on your schedule. Good afternoon, Laura. How are you? Just a couple of more minutes or seconds, and we'll get started. I wanted to connect with you today, just to go through some of the questions that are arising, and they're all great questions related to the state requirement for COVID-19 screening testing should a school district be designated as a microcluster. So that's what we'll talk about today. I also have questions that we received related to hybrid learning. I'll answer those questions as well. And if I'm able to, I'll answer any questions that we have in the feed. I'll be happy to do that too. Again, just as a reminder, if you have any questions, burning questions that I don't answer this afternoon, feel free to reach out at any time. First and foremost, good afternoon, everybody. Hey, Lori. Hi, Dina. It's good to see everyone. Thanks for jumping in. Hey, Nurse Maggie, thanks for being here with us. I hope that everyone had a really nice Thanksgiving holiday on behalf of the board and everybody here in the district. We hope that you were able to enjoy yourselves. I know you all stayed safe, and hopefully everything is going well. These are not easy times, no doubt about it. We're still moving through the challenges together. I even get from time to time people say to me, hey, why so positive? Why so positive? Well, look, we have to be positive, right? We have to take what we're dealt every day and sort of work our way through it together, and we've been doing that since March. We're going to keep doing that. Every day brings sort of a new wrinkle or a new consideration or challenge, but we'll move through it. And as long as we're able to support each other, I think we'll be able to do that just fine. Lots of questions, lots of opinions related to so-called holiday pause, right? Going to full remote learning following the Thanksgiving holiday through perhaps the winter holidays, Christmas, Hanukkah, Kwanzaa, New Year's, lots of conversation, good conversation, a lot of opinions, strong opinions, all reasonable, and you can understand, and you'll see from some of the questions that we received today, that they're sort of on all sides of the board. So as I had made mention at our last reopening committee meeting, and I'll do that right now again, is all of the options or all of the possibilities will always remain on the table with regard to how we approach each individual day, given what we're experiencing with regard to COVID-19, with regard to positivity rates, with regard to the regional landscape. But just know that, even if let's say you're somebody who's really advocating hard for a holiday pause, you're being heard. I hear you, the Board of Education hears you, and we respect everything, your opinion, and certainly appreciate the feedback. If you're somebody who's advocating for more in-person instruction, same, we hear you. All opinions are respected. What we're doing right now is we are attempting to be able to continue to provide in-person instruction to our children following the health safety standards that we put into place for as long as we possibly can, uninterrupted. We've been really fortunate. Have we had cases of COVID-19 pop up in our schools? You know we have. You see. Even yesterday you saw the updates. Have we seen spread in our buildings? Fortunately, no. We've not. And again, credit to everybody in our facilities, credit to everybody in our school community for doing what they can to minimize spread. That's what this is all about, minimizing spread. So we see numbers of COVID-19 going up all throughout the state of New York, going up throughout Westchester County, going up throughout the lower Hudson region, yes. Fortunately, we don't see any indication that there's massive spread in school facilities. I personally believe it's probably because school facilities are some of the most safe with regard to procedures and protocols, safe public facilities that are around, right? Way more health safety procedures in public schools than there are in, say, the supermarket. Not saying that the supermarket doesn't have them, they do. But all of these steps that we're taking every day are helping to minimize spread. And again, that's what this is about. Will a holiday pause have to go into effect at some point in time? Maybe. I don't know right now. What I can tell you is we're going to continue to focus and look at the data that we have each day to make the best possible decision that we can in the name of health and safety for our children and our staff members all throughout the educational community. So I really do appreciate all of the feedback. I also really appreciate your patience and your flexibility as we work through this. We knew this was going to be a tough time of the year, right? We know the holidays are a time for travel. We know the holidays are a time for gathering. We know all of those things exist. It's going to be the winter. Very soon we'll have cold weather. All of these things are going to factor into whether or not we have higher numbers of identified cases of COVID-19. So we'll keep you updated there. And we have another reopening committee meeting tomorrow. And as always, we'll post that reopening committee meeting so that you're able to watch it at your convenience. As we move into the winter holidays in December, it's December 1st already, right, today. We're going to continue to advocate to make sure that we're taking the appropriate steps at home, outside of school, to help us here at school to remain open to the extent that we're able. Following all of those health safety guidelines, physically distancing, making sure we're wearing masks, washing our hands, staying home when we're ill, all of those things that you've come to know over the last 10 months or so, 9 months or so, and that you've been working so hard on. Thank you for that. We're going to keep looking at data, and again, if the data suggests that we need to make an adjustment to schedules, we're going to do that. I think you know that. You've seen that happen in the past when we've had to shift, we've had to pivot quickly to remote learning. All of our moms and dads, all of our guardians, everybody in our educational community understands that that could happen at a moment's notice. That said, we are going to hang on as tightly as we can. Health safety first, of course, to try and continue to provide in-person instruction. We know how important it is to our children, we know how important it is to our community, so we're trying for that. All right, questions. I will start with questions that have been categorized. Hey everybody, good afternoon. Questions that have been categorized by, first by hybrid learning, and then I'll move to testing. First question. Dr. Fauci has recently announced that there's no reason that kids should not be in school. That there's no reason that kids should not be in school, and that in fact, the younger children don't even really need to wear masks. How is that impacting the reopening plan? Thanks for your question. I am aware that Dr. Fauci did make a statement recently about the importance of in-person instruction in our schools. I agree with that wholeheartedly. It was also a very nuanced statement where Dr. Fauci went on to indicate that depending upon the situation in any given place, that hybrid learning, remote learning, modification of schedules, all of those things could be in play. But he did urge, for sure, that schools should do all that they can to remain open for their children. I agree with that. In terms of children wearing masks, that I did not see. I don't know, have not seen anything about advocating for children not wearing masks. I can tell you that right now we've not shifted our approach in terms of wearing masks in our facilities, and I don't foresee us shifting that in the future. But certainly if there are any changes to the New York State Department of Health guidance, we will adhere to those as appropriate as well. Is there any discussion in allowing full 5 days a week in person for elementary schools now that New York City is going to do this, and Dr. Fauci declared there is low transmission of elementary school children? So thanks for the question. We are always, again, as I mentioned, exploring all potential possibilities. I have heard and I am watching, of course, what's transpiring, what the plan is in New York City, as well as the plan the plans in the surrounding districts in our particular area. I do not believe at this point in time we are capable of having in-person instruction 5 days a week for every child and still maintain the health safety guidance and guidelines from the New York State Department of Health. Can't speak for New York City or how they're going to approach that, but we've not taken that approach right now. The other approach that we've not taken is we've not taken a K-8 only approach, which I know some folks have been advocating for. We are looking K through 12, pre-K through 12 really, and trying to bring as many children in as often as possible in all grade levels, not just elementary school. And listen, me as an educator, as a parent, as a community member, depending upon where you are, you can make an argument for really any grade level, right? Get them all in. I mean, the argument is that really all of our children need to be in school every day. That we know. We also know that unfortunately right now, in dealing in the pandemic, that's not attainable at the moment. So we'll keep working on that and keep you posted as we move forward. My son currently goes to school 1 day a week. In the event that I deem the virus is out of control, can I keep my child home to learn remotely for a month or two until I think it's safe to go back to hybrid learning? Do I have to alert anyone beforehand? Yeah. So moms and dads, guardians, if you would like your child to participate in remote learning, you absolutely can do that at any time. Please notify your child's principal, and we can make sure that we're supporting you in that decision. We do ask, we have asked that parents and guardians, when they do choose full remote learning, to the extent possible, that they keep that choice for the marking period. That, again, is to allow us the flexibility to potentially bring more children back in that spot that now opened up in that classroom. We understand that things change and parents might need to shift, and that's fine. But one of the things that makes it very hard for us to bring more children back in is people moving from remote to in-person without a really kind of a set schedule. So working with your principal on that would go a long way. Has any progress been made in opening for in-person learning more than what we are doing right now? So you can see how the questions are sort of all on all sides. Yeah, I think the progress that we have right now is that, yes, we've put out surveys, we are collecting data on people who are interested in more in-person learning, and we're still functioning right now in in-person learning, which I think is a win based on what we're seeing, on the landscape in terms of increasing numbers of COVID-19 cases. Are we able to reevaluate our current hybrid situation, as many people in the school community feel having one teacher for both virtual and in-person learning is not working? Thanks for your question. If you're experiencing something particular, you probably already did, but please reach out to your child's teacher, your child's principal. We'll try and assist you there. Right now, what we've tried to do and what we've continued to do is to have our children in their classes. So that when it does become possible for more in-person learning to take place, they're still in their class with their teacher. We don't have a two-tiered system of fully remote teachers and in-person teachers. We've tried to avoid that. We've tried to avoid creating a two-tiered system of education, and that's where we are right now. How can we solve for less screen time in the classroom when my children are in person? My third grader is on his iPad the majority of the day that he's in person. Thanks for the question. I think, again, reaching out to your child's teacher and working that through, or your child's principal might be able to assist there. There definitely is a lot more screen time in the last 9 months. There's no doubt about that for all of us, I'm sure. Teacher absences. My son has told me that one of his AP classes has been canceled with no Zoom at all several times in the past few weeks. How are you ensuring that they are prepared, that the children will be prepared for the AP exams, and even if those are canceled again, for their college careers? It seems to me that unless a teacher is bedridden, they can still do a Zoom. Can we get more building subs to cover the classrooms while the teachers do their Zooms from home? Thank you for your question. I think this is a great question, and it's a real important point. When teachers are absent, or when administrators or support staff are absent, they're sick. We've had increased numbers of folks who are absent because they're sick. We've also had increased numbers of folks who are absent because they're in quarantine. When individuals are in quarantine, they are able to engage in remote learning and hold regular Zoom classes and the like. Now, I can't speak for this individual example, certainly, but what I can say is I think we have to recognize that when teachers or support staff or administrators are out, they're sick, just like everybody else. So doing their best to make sure that they're connecting with their children. But certainly if you're seeing a troubling pattern in a particular class, please reach out to your child's teacher if you haven't already, or your child's principal, or us, and we'd be happy to help in any way that we can. But I do appreciate you bringing up the challenges associated with absences. Now, building subs, yes, as many building subs as possible. Building subs get sick too. The pool of substitutes, that's always a challenging pool of outside of our district substitutes, has dwindled as well. Again, more challenge, right, that we have to face. For our building subs who are able to cover, they're everyday heroes, and I appreciate that. If you're listening to our team members, thank you for stepping in. But for moms and dads and for parents and guardians to remember, just like everybody else, we have experienced upticks in absences because people are sick or they're quarantined. But if we can make adjustments, we'd be happy to do that as well. Is a district willing to look into the lack of balance among the two cohort sessions to identify the disparity in the number of school learning days across the two cohort groups and willing to take steps to achieve better parity regarding the number of school days in the two cohorts? The basis of this question is founded 100% on ensuring students in the Monday-Tuesday cohort receive the best possible in-school learning opportunities, and specifically the number of in-school classroom learning days roughly equal to those in the Thursday-Friday cohort. This is a topic that's been discussed with many in our community with children in the Monday and Tuesday cohort. Thanks for your question. I think this question was probably, felt a little bit different at the beginning of the year before we had so many instances where we had quarantining and situations that really are outside of our control whatever day they fall on. Yes, we have been looking at, and we've taken steps in some instances to be able to try and level out those days. Not successful in every instance, for sure. That's just going to be an ongoing challenge in dealing with rolling quarantines, rolling remote learning, situations that arise. In terms of holidays and scheduled holidays, they're roughly equal, so there really wasn't a big disparity there just in terms of the regular traditional calendar. But yes, we are doing what we can to try and minimize any disparities that there are. My two kids have said that they only have 5 or 6 students with them in class on Monday and Tuesday. Would it be possible for them to attend Thursday and Friday as well, assuming that there are also few kids in those classes? Given that there are many remote kids, there must be available desks that sit vacant all week because students who are full remote. Why not allow the kids who are able to attend in person and change to leverage those desks and attend in person for more than just 2 days a week? Can this please be considered? If it's rejected, then I think parents deserve an explanation as to why, so that we can fully understand and appreciate the situation. Yeah, and thanks for the question. We are absolutely looking at all those types of options. I'm sure you have listened to the reopening committee meetings. That's something that we're looking at, the principals are looking at right now, particularly at the secondary level. What's important to understand is if your child has experienced a class with, say, 3, 4, 5, or 6 students in it in one period, it doesn't mean that that's going to remain constant throughout the rest of the day. That also, again, could be impacted because of quarantining of certain students in certain groups on certain days. It is a real moving target. It is very, very difficult to predict with any certainty if there's going to be an opening one day and then not one another. What we don't want to do is we don't want to welcome students back and then say the following week, now we're unable to achieve the density requirements, and unfortunately you're not going to be able to come in anymore. We're really trying to get a handle on that. We've not achieved that yet. There's no question about it. The bottom line is this: we do want to have more children in more often if we can. So we're working to look to identify how we can do it. We've not been able to achieve it with any certainty right now as of yet. But again, thanks for your question. Okay. COVID-19 testing. So yesterday we sent out a really asking parents and guardians for their consent for their children to participate, and staff members, for their children to participate in COVID-19 testing. And we knew absolutely that this was going to generate a lot of questions, and even after today, there will still be more questions, and yes, we'll send out a FAQ, we'll send that information related to the testing if we need to start testing. That's a big if. It's likely that will happen though, right? We've been watching cases increase. We're watching and listening to the governor in terms of the micro-cluster strategy throughout the state of New York. These are the so-called yellow zones, orange zones, red zones. We know that the plan has just shifted now to a winter plan for the state of New York, which will change some aspects of the requirements for public schools depending upon the zone that they're designated. The long and the short of it is this: all school districts, if they're designated in a particular zone, if they want to offer in-person learning, will be required to test their in-person student population. The tests that are going to be used come from the state of New York through the county and then are administered at the district level. They are the rapid antigen tests And I know what you're saying right now. Those are the unreliable ones. Yes, those are the ones that are less reliable, certainly, than the PCR test. This is not a diagnostic procedure. This is a screening procedure. And there's a real important distinction there. This is a screening procedure to make sure that in this particular percentage group, whether it be 10, 15, 20% of in-person folks, that we're identifying a percentage within that group of positive cases. Those numbers are then shared with the New York State or the county, the New York State Department of Health, as well as the parents and guardians. So, if your child tests, you consent to the test. Your child comes to school, takes the test, tests positive. What happens next? You go home. You could engage your healthcare provider for a PCR test. Those are the tests that are a little more invasive and require a little bit more time to receive the determinations, but they are more accurate. To get an outcome there, or stay home for 14 days in quarantine. And if you're negative, you're negative. So I'll answer these questions. If there are more questions after these 2 pages, I'll be happy to answer them too and give you a little bit more detail. But let's see what the questions bring first. Can we have our children tested outside of school? You absolutely can. If a school district is put into a designation and you wish to have your child tested by your own healthcare provider, you may do so and then be able to show the school district that you got a negative test, but it has to be in the window of time during which the school district has been designated. It can't be a test from August, obviously, right? But you have that ability to be able to do that. Who will perform the testing? Will it be a school nurse or other contracted medical professional? In the White Plains City School District, we would like to use all health care folks. It can be anybody. I took the training to administer these tests. I'm not going to be administering tests, but I wanted to see what the training is like. It's very quick. It's very simple. But we in the White Plains City School District, if we need to move to testing, are gearing up to be able to use healthcare professionals to conduct the testing. Will the test be the mid-nostril or the nasal pharyngeal swab? It's the mid-nostril. It's the less invasive. Both nostrils, five times in a circle, and then you're done. It's not the one that goes higher up. Will when will the testing take place? First thing in the morning or in the midst of instructional time? We believe that first thing in the morning would be the approach right now. Of course, everything that we're talking about right now could change, but we believe first thing in the morning before you come into the building. Will testing be random, or will we be notified of a schedule? It's a random sample. So of the folks who indicate they approve to be part of the testing pool, that pool is selected randomly. I can't say with any certainty right now as to whether or not we'll be able to notify you ahead of time. Certainly if we can, if we would do that, particularly with younger children, so that parents have a heads up. But I don't know that we'll be able to do that. So just know that it is random, and those tests would be in the morning. Do we have an opportunity to opt out because of medical or other concerns? For instance, my child has a history of nasal issues, and I would prefer to know in advance. You don't have to consent to the testing. We are asking for folks to consent to the testing. We know the more people that consent to this testing, the bigger the sample pool will be, and probably will give us a better sense of data in the screening process. But parents and guardians certainly have the right not to consent. How soon will we, the district and or parents, have the results? And will it be sent to a lab? The tests are the rapid kind, as I mentioned, the rapid by-next tests. The cards, 15 minutes or so, you have your result. Positive cases will be notified to parents and guardians, as well as New York State and the County Department of Health. Given the possibility for false positives and false negatives, what's the follow-up protocol based on the results of school testing sites? So if you test positive, you would move into, you'd go home 14 days in quarantine, or get a test from your healthcare provider and be able to show a negative result. How often will the testing be done? If a child is selected for the first 2-week period, will he or she be exempt for the following 2-week period, or is there a chance the child could be tested every 2 weeks? Thanks for the question. So testing, and again, all this could change, right? So yesterday we learned that there will probably be a lengthening of the period of time Now it would be 20% of the in-person population over a month, no longer 2 weeks, right? Could change again. And it should be a different pool of tested individuals each time. So the idea here is that you're not going to see the same children, the same staff members coming up in the same pool over and over on a monthly basis. Those of you who are thinking, well, if the pool is small because people don't agree to testing, that's not going to help. You're right. If people don't agree to consent to test, and if we have a very, very small pool of in-person children who are not consenting to test, that does further complicate and put a challenge in place for us. I don't know what the outcome of that is yet. We'll have to wait for more guidance from the state of New York. What happens if families don't return the permission form? Will they be required to switch to all remote learning? No. Not at this time. We've not received any indication that families who do not consent to be tested would be excluded from in-person learning. However, again, and understanding that everybody's situation is different and healthcare concerns and the like, respectful of all that. But remember, the more we know, the better off we'll be. Well, Joe, these tests are not accurate. They're more accurate than no tests, right? So even if the accuracy is lower, if we do have to move into this scenario, and we are designated as an orange or a red or a yellow region, and we do have to test, we'll know more than we know without being able to administer screening tests. Do students need to complete the consent form in order to attend? I just answered that. If students don't need to complete the form, will my child be tested more often because you have consent from me? No, we don't believe so. We believe that those individual groups would be held out in terms of the ongoing testing process. Where and when will testing be done? How often will a student be tested? So testing would be done at our facilities. We will put a set aside appropriate area to conduct that testing. Again, it's not invasive, it's very quick, and we should be able to move through that process relatively quickly. How often will a student be tested? It should not be often. It should be on a rolling basis. And as we have a larger student population, you should expect that the pool being a larger pool, the random tests would make it so that you wouldn't be tested all the time, same people all the time. Will kindergartners be required for testing? Right now, yes, we haven't received any indication that there are any groups of children who are excluded from this requirement. Will parents be present for the testing drop-off each morning? No, not necessarily. As you can imagine, having parents present during that period of time would just make for more people and higher density, and we want to avoid that. Again, this is not the invasive. It should be a pretty quick and easy process, and certainly we would talk with our children about this if we need to move down this road. Will there be a method put into place so that the same testing population doesn't? Yes. Will more details regarding testing be communicated to the community other than Facebook Live? Yes. The email was vague and lacking specific details that parents are looking for. Yes. And if you ever get an email or if you ever get information that you feel like there's more you need to know, please feel free to reach out to us because maybe we're just not thinking of your question, and we'll be happy to answer it and then include it in future updates. As a parent of a future 2021-2022 kindergarten student, I'm wondering how COVID will affect this year's kindergarten registration process. I know that during a typical year, information sessions would have already been held and plans for school tours would have been in the works. Obviously, this year is far from typical. I am just wondering what we can expect the process to look like this year when we expect it to begin. I think a hybrid learning question snuck in there to our testing. Yes, absolutely. The kindergarten registration process is different this year. In-person tours will not be taking place like they have in the past for sure. We are looking to be able to still provide our prospective tigers and parents and guardians with an experience that will meet their needs in terms of the registration process and still be able to adhere to our health safety standards. Keep an eye out for that. That'll be coming up in the winter. But yes, pushback and definitely different than in the past, which would have relied heavily on in-person experiences that unfortunately we're just not able to accommodate at this time. When will the testing of students and staff be done during the day? We'd like it to be done at the beginning of the day. Will it be done in the nurse's office? It likely would be in a different location than the nurse's office, a larger location. If White Plains heads towards an orange zone in the next few weeks and testing takes up too much of the school day, and working parents' times, would it be more beneficial for the district to consider a holiday pause? I am all for schools being open, however, testing and waiting for results would be an added stressor for children. The pause would help to decrease some of this extra anxiety. Thanks for your question. We think that it would be unlikely that the testing process, given that it's a sample of the student population, the sample of the in-person population, would take an exorbitantly long amount of time. And hopefully we'll do our very best to alleviate any anxiety that comes along with that experience. So we don't know that that would necessarily impact the reason for a holiday pause. Holiday pause would typically be if we see COVID-19 cases spreading certainly within our educational community, or we get to a point within our greater community where we believe that the schools are being open for in-person learning is potentially increasing the risk for community spread. Those are the questions so far. I am going to go into the feed and see if there are additional questions that I didn't answer. And again, if I didn't hit your questions, feel free to email us, and we'll make sure that we get them next time and/or include them in our frequently asked questions. Good afternoon, everybody. It's great to see you. Be positive, test negative. I love that. That's so great. Thanks, Elizabeth. Has there been any evidence that COVID is spreading within our schools? I know that there are positive cases, but just wondering if it's been spreading through classes or schools because of those cases. Thanks for the question. Fortunately, thank God, I just feel blessed about this. No, we're not seeing that. Doesn't mean it can't happen. It doesn't mean that, I just didn't see it, that, 2 kids did get it from each other. I don't, what we're seeing, we're not seeing that widespread. We're not seeing any indication that there's spread in our schools, thankfully. Certainly if we did, we would immediately act on that. The governor indicated this week that K-8 should stay open so long as it's deemed safe. So assuming we stay within the guidelines of what's deemed safe, are you still considering a holiday pause? I think I maybe answered that, Michelle. Again, everything's on the table. Moms and dads, parents and guardians, if you are concerned about sending your child in person at this point in time, you always have the ability to make a change. And that's important to understand. Our parents and guardians, our children, you have the ability to make a change. So if that's something you're concerned about, please reach out. Certainly, for us here, we're in a different scenario, and for my colleagues, I absolutely understand the concerns out there, and we're doing our very best to make sure that everybody in our educational community is as safe as possible. Hi, Kelly. What would the criteria what will be the criteria for a holiday pause? Essentially, one of 2 things. One, it could happen from the state down, of course, but also if we see numbers increasing, in our school facilities, and we get to a place where we think that there's spread within our schools, that would absolutely be a reason for a pause. Anything that could potentially impact health safety. While I understand you're trying to bring all grade levels back more, should there be some greater consideration to the younger kids? The younger ones simply can't do full remote on their own, which is a huge strain on parents who are trying to work full time. Thanks, Michelle. I absolutely understand. And I have learned over the last 9 months that you're right. You're right. The mom who says that their 12th grader is experiencing X, Y, and Z, they're right. And there really is, it makes it very difficult. Every single grade level, every single child, we all have an example of why in-person learning is so much better, so much more effective on so many more levels than remote learning. But we have tried to really come at this through an equity lens of getting allowing all of our children, regardless of grade level, access to in-person learning, as imperfect as it may be. That's where we are right now. Could that change? Could it be mandated? All those things remain to be seen. But certainly I completely understand and respect your position. How many sick days are teachers allowed to take? Well, every employee has a number of sick days that receive on an annual basis. I think it's like 12 or 15. And they accrue over the years, so some folks, depending upon the longevity that they've been with the district, could have more sick days than others. So that it really depends on the individual. I can tell you that when people are out for a period of time, they are in communication with our school nurses or their principals, and there is always a reason. And typically, 99.9% of the time, there are pretty significant reasons. Folks want to be at work. Teachers want to be at work. I've not seen and I've not bumped into teachers in the White Plains City School District who are trying to avoid the classroom. Have I bumped into teachers in the White Plains City School District or administrators or staff members and in other school districts who are concerned? Absolutely. Everybody, there are so many people who are concerned. But I don't think what we're seeing is avoidance. I think what we're seeing is increased number of illness. At least that's what the data tell us. So in terms of the number of sick days, they vary. But when folks are sick, we try and support them as best we can. If we choose not to sign that COVID testing form, does that mean we are electing to go fully remote? Nope, it sure doesn't. Hi, Desiree. First graders have been hit the entire month of November due to quarantine of teachers. Any relief opposed to being in fear from losing federal funding? No, we have no concern of losing federal funding. That's one of those. Thanks for this question, Desiree. It's one of those legends or rumors that are out there that the only reason schools are staying open is because they have to stay open for federal funding. That's not the case at all. In fact, as you know, the federal government doesn't nearly send enough of your tax dollars back to White Plains to support the White Plains City School District. So really, that has no bearing. What we're attempting to do is we're trying to educate children in person as much as we possibly can, as safely as possible. But we're also dealing with the very real situation of illness on a daily basis. What department will be performing the COVID-19 testing? That would health services, and if needed, in conjunction with a community partner, also health services. Will you be considering 5 days a week, like for elementary school, like New York City? We'll have to see. We'll have to see, and certainly the reopening committee will discuss all those types of options. I know what the mayor said. Watching New York City very carefully, as you have been, I also know that there were some real concerns and some challenges in trying to achieve that. And just as a hypothetical, not saying that this isn't a good idea. K-8, all K-8 students, all 9 through 12 students are remote. Ostensibly makes sense. 9 through 12 students, older, more mature, more developed, they could log in easier. That's also the group of students, by the way, who could just sign themselves out and walk out of school, right? K-8 can't do that. Do we run the risk of losing more children to dropouts if we put a singular focus on K-8 for in-person learning and not 9-12? I don't know the answer to that, but as a teacher, that's one of the things that immediately pops into my head in terms of in-person learning for a singular group of children. What happens to the other group? So we'll have to see, but certainly everything is on the table. Groups definition. Grade levels of children, age levels of children. I don't know. Random children could be those riding the bus. So we're talking about. Oh, I'm sorry. I'm missing you here, Desiree. Is the random COVID testing based on geographic locations where they may be deemed? Nope. Those will be pools at each individual school. Random children could be those riding the bus. So we're talking census. Pools. So pools of children who attend school in person. Those are the pools, and who have consented to be part of the testing. Those are the pools who would be selected for testing. Are positive cases in the district adults or students? They're both. Both adults and students have come down with COVID-19. Can you resend the link to consent? Mine wouldn't open. Sure, we'll make sure that it's up on the website too, and we'll put it up on Facebook so that you can see it. I read that Rockland was doing drive-through school testing. As an elementary age mom, I would feel comfortable to be present for my young children to be tested. Drive-through testing seems more appropriate for elementary age children. Is it a possibility to explore? Sure is. We're not exactly sure how that's going to ramp up and roll out yet. We have to sort of see what the exact requirements are going to be. If we can so let me say it this way. We're going to do everything we can to make this as efficient and painless, I mean, figuratively painless as possible, so that it's not an extra stress on you or an extra stress on our children. And thank you, Liza, for putting up the consent. Would I be notified if someone in our school bus was asked to quarantine? You're always notified if you're part of a contact trace and your child could have potentially been exposed to somebody who's been asked to quarantine. If a neighboring school district is deemed a yellow zone and we are not, will we be asked to start testing anyway? No. Not everyone has a car. That's true. That was related to drive-through testing. 12th graders are experiencing X, Y, and Z. Thank you for everything you're doing. Thank you. Sorry, I should have read that before I started reading. I had emailed him yesterday. Okay. Do you anticipate next year's 21-22 kindergarten will be hybrid learning? I certainly hope not. I'm thinking about the 21 and 22 academic year as a in-person, all people in-person school year. And I know you are too, and I know we're all working to get there. So no, I'm not thinking about that yet, for sure. If I start thinking about it that way, I'll let you know. What is the communication chain to let high schoolers know that a teacher's out? Notification when class can't have been iffy. I think maybe reaching out to Mr. Martinez with that question might be able to help you. It's a little more targeted toward a student's particular schedule. But hi, Desiree, but it was stated by Washington. I don't know what Washington said related to federal funding. I think maybe you're referring to a threat that was made over the summer to open schools, or federal funding would be withheld. Washington doesn't have the ability to just withhold money based on what a certain portion of the administration may or may not want. Is it appropriate to be questioning your teacher? I can understand people's questions related. Thank you for that question, Denise. I absolutely can understand people's questions related to attendance, and that's why I really wanted to be real clear, just so everyone understands that just like everywhere else, we're experiencing attendance issues because people are sick. And things happen, and people in their family get sick, and all of those types of considerations that everybody is going through right now. So I appreciate that, Denise, and I know our teachers and our staff and support members and our administrators appreciate that grace as well. Hi, Mrs. Nunez. You're very welcome. What happens if we sign the form but the child has a negative experience and will not allow the nurse to complete the test? I think, I can visualize what you're saying. So I say it's okay for my 6-year-old to go ahead and get tested. He pops up that day, has a meltdown, doesn't want to test. We'll handle that, and we'll definitely reach out to you. We don't want our little ones crying and stressed out about this process. Many teachers have been quarantined. That's all the questions that are in the feed right now. What I'm going to do is make sure that we come back again, probably next week, and we'll make sure that if there's any additional information this week, obviously we'll communicate that with you as well. Hopefully you had some of your questions answered. Again, as always, if you need to, reach out and ask any questions that you can. I do want to leave you on this note, and this is a note of positivity. Everybody's tired. Everybody's tired. There's no doubt about it. But we are still in the fight. And, this is not me being overly optimistic or just, a cheerleader. We're still in this fight every day to keep our schools open, to keep in-person learning happening, to keep services and supports available for our kids. Imperfect, again, as it may be. We're doing it every day. I can't say enough about the folks who are out there and working so hard to make this happen. You, moms and dads, and our guardians, thank you. It doesn't make it easy. It doesn't mean we're always happy, but we are pushing through. And here's the other thing. Our kids, they're doing a great job. They really are working very, very hard. If your child is struggling, if you're you're experiencing difficulties in your classroom, please make sure you reach out to us. We want to do everything we can to help. Thanks, everybody. Thanks for jumping in today, and thanks for spending your time. Make sure we'll get back to you soon, and if you have any questions, reach out at any time. Stay safe, stay strong, and stay WP proud. See you soon.